welcome everyone. Namaste. Welcome back to my channel of Becoming Conscious Being, which is an online platform for your mental health and well-being. And I'm very excited for the conversation today that we're going to have around breast cancer to just understand what is breast cancer, the preventive aspects, understanding about the resources available for families, for the client. And for this conversation, I'm very excited to have Pranjal Dange with me. Yeah. Hi, Pranjal. It's so
Yes.
nice to finally have this conversation.
Good evening.
So excited for this.
Same here. Same here. Thank you so much for introducing this topic. And it is very essential nowadays. People should be aware of this is very important issue. So awareness is the most important thing which can uh, make people to understand this complicated issue. Nowadays it is increasing. So I congratulate you for such a nice choosing this nice topic. So
Thank you very
you are
much.
helping others by that.
Likewise. And before we dive into this conversation, just a brief overview about Pranjal and myself. So Pranjal is a counseling psychologist practicing as a psycho-oncologist as well. She has been in the field for 7 years and is now resuming her practice after a little break because of focusing on other aspects of her life. So I'm really glad, Pranjal, and I'm sure it's an inspiration and encouragement to a lot of other women also who are starting their professional practice after a gap. So thank you for bringing
Yeah,
that
it
energy
was. Thank you so much. It is difficult to start back, but thankfully I'm having a wonderful connection like you, who
in.
are supportive very much, and likewise, I'm looking forward for great work ahead with you and with others also. Let's make this world very beautiful, and let's prevent the cancer, especially breast cancer in women.
Yes, right. So as we begin this conversation, can you just give a brief to understand in layman's term what is breast cancer and how prevalent is it globally and in India?
See, breast cancer is a disease in which cell in the breast grow out of control. There are different kinds of breast cancer. So, the particular cancer can be explained by after diagnosis and with the help of oncologist, that is cancer specialist doctor. The kind of breast cancer depends on which cell in the breast turn into a cancerous cell. It's an accident in your body. We all are having cancer cell. It's only thing uh, it gets activated or it's mishaps. It doesn't require any particular thing. So many things can cause breast cancer, but you can easily identify, or there are many measures you can identify the thing. So Indian woman is very prone to, it's a 14%, it's a mass amount of women who are suffering from cancer. It is reported that with every 4 minutes, an Indian woman is diagnosed with the breast cancer. It's on a peak, both in rural with urban India.
Okay.
So globally, breast cancer has become a leading cause of mortality in women.
And so with that, I also wonder, with such a high prevalence in India especially, is there enough awareness or enough motivation among the women and families to access healthcare for diagnosis, for tests for breast cancer?
See, we are having all the facilities. I mean, the screening camps, and there are some tests which can detect the cancer in very early stage.
Mm.
So there are many, but less awareness. and the stigma, or people are very reluctant to take the chance. But every woman should undergo all this test or all this screening test. Very difficult situation, so one should get through all these things as early as possible. Likewise, we go for a annual checkup, body checkup, for heart, for diabetes, or for any other thing. So one should go for lack of awareness was.
Okay. Yeah. And while we come to the preventive aspects and resources a little later in the video, I also wonder there might be a lot of myths which also that are prevalent about breast cancer, which also create a hindrance in the detection also in for people to access the healthcare also. So what are some of these myths in the around
Yes,
breast cancer?
n number of things, many myths, like if you don't have family history, you will not get breast cancer. It's not like that. If you are having a history of any type of cancer, you may get breast cancer. So, as I said, uh, that you should go under, you should undergo all this test, all this awareness programs that will help you. So it's not like that that if you don't have anything in your family, you will not get it. Many people think that if you have a healthy lifestyle, you don't need to worry about it. It's not like that. Healthy women also get cancer, and even young girls, as we have discussed already, in very early age, very young age, girls are suffering from breast cancer. And one biggest myth is like only women get breast cancer. No, we are having many men who suffers from breast cancer. So it is not like that that men are not suffering from breast cancer. There is some other test which can help people to identify all this in men. So not only women, but men also should undergo, or men should be aware of all these things. So this awareness program is not only for women, for men also. One more myth is cancer only affects older women. So as we have discussed, it's not about the age. At any any age, you can this can happen. Uh, there are lumps in your breast, so every lump in your breast is cancerous. This is totally wrong. We are having many kind of lumps which is watery. We call it benign lumps. There are many small and big lumps in your breast. You can feel it when you touch it. So it is not like that every lump is cancerous, but you have to be careful about it. It can be a cancer. Yeah. So this is one thing that people should understand. So many times breast cancer start from your armpit, like we say that the tail of your breast. So tail of your breast starts from armpit. So from that, from armpit also, you can identify if there is any lump or anything. So it is really difficult. It takes time to identify, but regular screening can help you. So it is not like that that something in armpit is not for it's nothing related to breast cancer. It can be. So if you feel or if you have pain in your armpit, if you have problem in your hand moving in upward direction, you should go for screening, and that can help you to identify it as early as possible. And if it is nothing to be worried about, you will be clear about it. So screening is the thing that you have to go over. There are many other things also, there will be always a lump indicate breast cancer. No. So breast cancer has only one treatment option. It's not like that. Surgery is not the only thing. There are many. Without surgery, also it can cure. So it's depend upon the nature of the cancer.
Okay.
Some people also feel that doing mammography, because of the rays of a mammography can cause cancer. So no, it's not like that. That rays is not harmful. It is for detection and screening. So these are some myths, and should be addressed in a deeper way.
Yeah, definitely. And I think one major highlight that I received from this was
Yes.
it's not dependent on any gender or sex. I think that's a major myth buster for myself because I think that is something that I used to believe in. So thank you so much for that.
Percentages, yes. Thank you, Purvi. Percentage is less, but there are chances.
Yeah.
So the awareness programs should be conducted not only for women, for men also, to educate them about what is breast cancer. So,
Right. And so with this, I would also want you to then discuss about what are the ways in which people can prevent or look into the preventive aspects of breast cancer.
marriage.
Hmm.
Many girls start taking contraceptive pills.
Okay.
So you should ask your gynac
Hmm.
before taking this pills,
Okay.
birth control pills or contraceptive pills. There are some tests like BRCA1, BRCA2, which will deeperly explain. I mean, doctor can explain it more clearly to you. You can ask them if you have a history, if you have a long and deeper cancer history in your family, you should go for this two test, which is
Hmm.
which indicates is there any type of cancerous cell or any risk of cancer in your genes. Talk to
Okay.
your doctor about other way to lower the risk. Okay,
Hmm.
these are the common symptoms of breast cancer, which we will discuss. There are like we can easily identify or we can screen it, like a lump in a breast or a underarms, as we were talking about. So thickening or a swelling of a part of your breast. So any part, you
Hmm.
if you find it swelling or a tightness or a some sort of tough part on your breast or in underarms, you should go for a screening as soon as possible.
Hmm.
Thickening or swelling of a part or irritation or dimple, like the like in your breast, if there is any dent type or the way we see the dimple on our cheek, if in that type of thing you see on your breast, you should go for a screening. Or any type of irritation on your breast or on a nipple, you should
Hmm.
seek help.
Okay.
Redness or some change in skin or change in color of your nipple or area around the nipple can be dangerous. You should go for a screening that time also. Uh, if it is if there is any blood or watery or white milk type substances coming from your from nipple, so that can be one of the indication. Change of shape, like it's increased or suddenly it shrink, that can be one of the indication. And pain in the area of breast, not around, only on your breast. That is the biggest indication. So one should understand these steps which help them to identify in early stage.
Yeah. And one thing I would also like to highlight is, like you said, right, about contraceptive. Right? A lot of times these contraceptive
Yeah.
pills, birth control pills are also prescribed when for people who are experiencing PCOD, PCOS, or sometimes even
PCOV.
when,
Yes.
or sometimes even when people experience pregnancy loss or go through abortion is also when
Hmm.
sometimes these contraceptives or birth controls may be prescribed. So, in those
Yes.
times also, would you advise people to discuss about the risks of breast cancer and be aware of that?
Like I said, that you before taking such pills, you should discuss this thing with your gynec or at least with your family doctor.
Okay.
One should not take directly because these are the doses. At least show it to your family doctor.
Okay.
So yeah, so gynec can explain you. Gynecologist is specialized in all these factors. So doctor can give you the right dose, and he or she can advise you for how much time and how much duration you should take that, because some of the ladies cannot take the doses of contraceptive. It gives them other side effects also.
Yeah.
So by full checkup, by full screening, doctor advice for this. So sometimes these pills are not for some ladies because
Okay.
it disturbs your hormones. It plays with your hormones, and
Okay.
hormone imbalance will create some other problems, like it may create some mental health issues. It will may
Hmm.
create some cysts which leads to cancer or any other abnormalities uh, on your body. So
Okay.
it is advisable that you should go for your checkup, screen yourself, and
Hmm.
then go for the pills.
Yeah. And even after a lot of times when people do follow these preventive guidelines, cautious, sometimes even then they might, develop breast cancer, right? And I can imagine
Yes.
the utter shock and the dismay, right? That comes not just for the client but
Yeah.
for the caregivers also with the diagnosis that comes. So
Yes.
much fear that comes along with the diagnosis. So if you could just share your experience, how is it for the clients and for their family and caregivers when they receive a diagnosis like this, and then what helps them in this process to accept it?
Yes. So Purvi, let me tell you first thing that I was a caregiver. My mother has suffered
Oh,
through breast cancer.
okay,
Now she's cured, but it was uh, the tumor was third grade, and stage was almost reached to third or fourth level.
okay,
So it was very painful for her, very scary for her, and as well as us.
I
Cancer
can
is
imagine.
the disease. Yeah, so counseling or the treatment, not only for a cancer patient, it is required to their caregivers also, because this is very financially it drains you, emotionally it drains you. So there are 10 factors that you have to balance.
Yeah,
Not only the treatment plus finances, treatment, pain, and when you see your loved ones in that way, it is difficult. It's emotionally draining thing. So, as I was in this field, so we were very much lucky to I just get a good to get a good doctors to screen. As I have discussed this thing that it starts from your armpit. Sometimes it starts from armpit.
Okay.
So that's why. It starts from for my mother. It starts from her armpit, and for some months we thought that it's just a frozen shoulder problem, but it was not a frozen shoulder. She was undergoing for a treatment of frozen shoulder. But as we discussed this things with our gynecologist, she she just explained us what is exact things. She suggests us about some tests which we have already discussed. My mother don't have any history of cancer, but unfortunately she got it. But early detection helps us to survive. Now she
Yeah.
is completely fine and cured, very healthy. It's
Yes,
her
God
second
bless
birth.
her.
So I have seen and yeah, that's good. So it's so I can understand how patients feel and how the caregivers also suffer that time. So actually, we were helpless. So it is a term called psycho-oncologist, which you have already uh, told. I mean, we have already discussed that I'm a psycho-oncologist. I deal with uh, patients of cancer or suffering from cancer, and I help doctors. I work with them to take care the mental health of the patients, because
Mm.
everything is very new to the patient as well as caregivers.
Mm.
So it is like we are highly trained psychologists on the in this part, like specialty of oncology.
Mm.
So we take care and we take care of all this multidisciplinary cancer team. Our expertise helps doctors to get better understand the patient's actual problem, psychological problem, because some of the patients are not ready to understand what is cancer, and they are into the denial that they got this thing cancer, and cancer is end of their life. So it so we counsel, we focus on psychosocial aspect of a patient and caregivers, uh, along with uh, uh, their physical and socio-economical um, and psychological concepts.
Mm.
We help them to get some. Uh, we work with the charity NGOs. We try to get money for them. There are many good people who give charity. So we help them to understand their needs, what is physical needs, what is psychological needs, what is financial needs, because that
Mm.
time they are very confused. We help them and their families to deal with the loss.
Yeah.
Unfortunately, if it is in a higher side of a cancer and they lose their loved ones, so
Mm.
that time also we help them, we support them, and there are many questions in their mind that what exactly thing is. So doctors, surgeons, they don't have that much time to explain them, because and sometimes patients also feel that why should I ask such stupid question to the doctor? But it is not like that. If the problem is big for you, so you should ask the question. You should not think that this is a very stupid question and why should I ask? What will he feel? Or it should not be in your mind and you are into the denial. You should ask. So sometimes it happens that we form the rapport with the patients and try to take out their doubts, though they feel it's a very stupid, but sometimes it's not, they feel it's stupid, but it's a big problem or a big issue to address. We explain then how will be the surgery, for what called it pre and post surgical counseling. We do that. We explain them about the surgery, the way of surgery. We prepare them. We try to bring them into the acceptance level so that the BP level should be at least stable or not get more fluctuation, because it's very important that your sugar level and BP level should be very stable when you are in OT, because it gives problem, or it is difficult to operate when the patient BP is fluctuating. So it may get more difficult surgery. We gave them psychoeducation and spiritual support as well. Meditate, calm yourself. So we prepare them in all such way. Like relaxation therapy we do. So there are many types of therapy we used, like REBT we used, or CPT we used to take out all this irrational thoughts, or to change their thoughts about cancer. So it's not the uh, end of the life. It can be your second life. So we just want to bring them on that level. So we explain them this things.
Yeah, and I can see the importance or the need of a psycho-oncologist in that entire process to really support the clients in the, and be well informed and have feel safe and trust in that entire process of treatment. But I also wonder, right? I can imagine that in this process, it can also bring a lot of doubt or distress towards their body image, towards how view their identity. I
Uh-huh.
also can imagine the distress of, the caregivers, the family, right? If sometimes they feel that, oh, can't show it or can't express it with the client. So there's a disconnect sort of comes in between the family and the client where both of them try to be the strong one, not express and
Mm-hmm.
suffer in their own selves, right? So I would really urge the caregivers and families also through this video that if you are someone who's caring, who is supporting your family member, your loved one through breast cancer or any chronic illness for that matter, any distress for that matter, please also do seek support, seek therapy for your own well-being as well. Because like Pranjal also said,
Yes.
right? And for you to be able to support and be there for the client, you also need to be
Strong
very
enough.
well,
Yes.
yeah, have your own coping mechanism support as well.
I want to add on this that caregiver also need a counseling, because they are seeing continuous pain to their loved ones, so they also get emotionally drained. They are able to express themselves. They are also having many doubts regarding the treatment. So if they approach, or there is a grief therapy, if you are in a grief, if you lose someone unfortunately, so there is a support for caregivers also. There is a palliative care also, which helps caregivers to understand that if there is nothing, many a time it happens that cancer, the metastatic means it's in your body, it's in full in your body. not only on a one path. So that time, uh, for a patient, we give them a palliative care. That means a supportive care, not related to cancer. So in that, we give them therapy, grief therapy, and we try to explain them step by step that now we cannot give you more treatment for your cancer, but we will give the treatment to other things which is very easily, as their immunity is very less, so they catch other infection very fast. So we provide them treatment for supportive care. So
Okay.
to make them understand that no, I'm not getting a cancer treatment, it's just other things, problem, uh, low confidence, and there are many problems which a girl or a woman goes through in her life after breast cancer. We address them and their caregivers, their family members. It's a group counseling to how to proceed further. So it's a
Okay.
vast topic to discuss. To be, it's a vast topic, and it's very essential if we want to keep it in control. Screening, early detection is very important. So it should be a part of your life, that the way you take a um, yearly examine your body, same way go for a cancer test as well.
I mean, that is such a great thing that you said because I can understand that. And I've seen that in a lot of, I think it's great now that media is also covering that work because I've seen a lot of some series or movies such that have also come out in where they actually show how the entire journey is for the client, for the caregiver, and even after that, how difficult is it to cope for both the patients, the families, and but always that anxiousness and the again the breaking of that hope if a relapse happens. The trust that or sometimes keeps breaking or keeps fluctuating a lot. So while yes, there's a lot of support now in terms of awareness in media, you have these shows coming up, right? You have therapy as a support system for clients, for caregivers. What are the other support systems that the families and the patients can really take along with the conventional treatment?
There are many other things also, which is that NGOs are helping. There are many NGOs which helps them to deal with all these things.
Mm.
They support them financially. They support them for the medicines because it's very costly. Some charities is an NGO which do the charity. We are having a Tata Memorial in that. There are many people who come for a charity.
One you said is Tata Memorial. You said sponsorship that can really help people in this journey
Yes,
for
the sponsorship.
right? Not just for their financial
Yes,
aspect, but for their medicines as well.
yes, they take care of their medicines. Especially some injections are very costly. They help them for that. They sponsor their injections and
Mhm.
other things also.
Well, there's a lot of other things I would like to discuss and know from you, but I think the scope of this video is only till here. I'm sure we'll have many more opportunities to continue this conversation, right? So with
Yes,
this, we are coming to the end of this particular conversation here. So thank you everyone for joining in, and
thank you
anyone
so
who is
much.
looking out for services of therapy for support can definitely reach out to Becoming Conscious Being and to Pranjal in case you have anything regarding support for families, for patients, for breast cancer. If you have any queries or you want support regarding that, our platform is always available. You can drop in your queries or feedback in the comments below. You can share your experience in the comments below, right? Because a lot of people can gain strength from just listening to these experiences, from the sharing. So the comments box is always open. You can always reach out to either of us. I will be linking our socials, my website link, and contact of Pranjal in the description below. So you can always check that out. Thank you very much. Any parting thoughts you would want to say, Pranjal, to our audience today?
Yes. I just want to say that don't ignore your health, and just I want to say that be healthy, keep smiling, and be positive. That's
Great.
it.
Thank you. Thank you so much, Pranjal. And thank you for audience for tuning in
Thanks for
today.
giving me such things.
It was
Thank
great
you.
interacting with you. It was a great discussion. Thank you so much.
Thank you.